Ghana Health Service has issued an alert following the outbreak of dengue fever in the eastern region. Now, the warning comes after the national surveillance system identified unusual clinical malaria cases in several districts that did not respond to standard anti-malarial treatment. According to the Ghana Health Service, these cases were managed and were confirmed as dengue fever by the Noguchi Memorial Institute for Medical Research. In a statement issued on Sunday, 14th of July, the service revealed that 9 cases had been confirmed. So on your screens now is that statement released by the Ghana Health Service. It says dengue fever is a viral infection that spreads from mosquitoes to people. Well, this is a breakdown of what it is for people watching and they don't have a fair idea what dengue fever is. It's a viral infection. It spreads from mosquitoes to people. It is more common in tropical and subtropical climates. Now, most people who get dengue fever will not have symptoms, and that's where the problem lies, because mostly they come to the hospital at advanced stages. Now, but for those who do, the most common symptoms are high fever, headaches, body aches, nausea, and rash. Now, most cases of dengue fever go away within a week or two and won't cause any lasting problems if you're worried about that. But if someone has severe symptoms of this disease, or if symptoms get worse in the first day or two after the fever goes away, get medical care right away. That's the concern, the Ghana Health Service. Now, these are signs you should look out for when it comes to this dengue fever. 1, abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation. You have mucosal bleed, and we have lethargy, or let's use restlessness, and liver enlargement, which is 2 centimeters. So that's why it's important to go to the hospital so that you get an idea about it. We also have laboratory findings of increase in HCT. That is some of the key symptoms you could look out for. If you're feeling abdominal pain and tenderness, if you have persistent vomiting, you should be worried about it. Let's take you to the eastern region, speak to our correspondent Kofi Sian, who is on the ground. Kofi, what can you report?
The Ghana Health Service in the eastern region have been meeting, and they have formed a team. Basically, these are members of the heads of the various units of the health directorates in the eastern region, and they consist of public health experts, disease control officers, pharmacists, and some physicians as well. And they are categorized into about 6 units, and that includes the surveillance and case management unit, and also the risk communication and social mobilization, as well as the case management and some other units. And they have been tasked to move to find out what exactly is the cause of the outbreak of this disease, and to also ensure that they find solutions or ways to curb this outbreak in the eastern region.
So far, have you checked up on these individuals to find out how they are faring?
Okay, so the health service has been a bit careful with how they are managing the case. So far, they have not been able to tell us the exact district or facilities these cases are coming from. But what we know is that it's been generalized. So you find out from them, and they will tell you it's the whole of the eastern region. But they will be coming up with the exact district later in the day and tell us where these cases are, so that we can follow up to them.
Thank you, Kofi Sian. We'll be back to you in subsequent bulletins, as I said, when you have updates. But then just some quick updates from the Ghana Health Service as to where we are right now. They say so far 9 cases have been confirmed, and that's what is contained in their statement. They say the global overview of this in 2023, the reason why they feel is very important is that they reported 6.5 cases in 2023, 3.5 million cases in 2023, and 7,300 deaths. And that's from the Ghana Health Service data. Now, what is it? We've spoken about it. It's a viral infection that spreads from mosquitoes to people. It is more common in tropical and subtropical climates.